Finally, as campus providers and staff in health and counseling and health promotion offices work on the front lines to build the well-being and mental health of our students, the issue of the resilience of these staffs tends to get overlooked. This session explores what leads to mental health providers and staff burnout, and how we can build campus cultures that embrace and nurture the resilience and grit of these same staff that provide such critical care and outreach to our nation's students. In other words, who cares for the caregivers? Up next is Sean Marz, Director of Training and Technical Assistance from the Alive and Well communities. Welcome.
Well, good afternoon. Now, I realize I'm the last speaker of the last session, and so I will be very mindful of that as I move forward. Now, today we've talked a whole lot about the resilience and well-being of our scholars. But it really begs the question, who's caring for the caregiver? What about your resilience and well-being? And so for the next 20 minutes, I want to ask you, take off all of your professional hats. I want to even encourage you to disengage from any technology you might be using and be wholly present. Just be wholly present and mostly for yourself. Now, as you're here with me, I want to pose a question. And the question is this. How many of you in the room can honestly say to me that you take excellent care of yourselves? Now, before answering, I just want to highlight something, that this summit does not count as a mini vacation. So by show of hands, how many of you can honestly say to me, you take excellent care of yourselves? Okay, I've got one. Do I have two? One? Okay. So then, let me pose another question to you. How many of you, in just the last 30 days, have maybe suggested or recommended to a scholar, a client, a patient, even a colleague, that they should engage in their own self-care? Show of hands. Whoa! Now, I'm not a researcher, but we have some sort of inverse relationship going on here. What's so fascinating is that when it comes to self-care, it's not that we don't know about it, because we talk about it in journal articles, in professional development, even at conferences. In fact, any one of you could probably get up here and talk about self-care. But what we have to recognize is that there's this big disconnect between knowing and actually doing. Now, the reason I like to ask that question about self-care is that in my work, I found that self-care is actually one of the biggest indicators for one's resilience. Now, we know the science of resilience. And the science of resilience is really awesome. That resilience is much like a muscle, right? That while some of us may start off more fit, we can intentionally and purposely build that resilience muscle. But here's the myth about resilience. We often think that once we have it, we've got it. But resilience is actually like any other muscle, that when I stop nurturing it, when I stop exercising it, it, like any other muscle, atrophies. So I want you now to reflect for a moment. If you had to rate your personal resilience on a scale of 0 to 10, where are you today? And as you reflect on that question, I want to ask, where were you 5 years ago? Were you more resilient? Were you less resilient? And now with that question, I want to ask you, where do you anticipate your resilience being tomorrow? We know the research is clear that each and every single day on your campuses, the work you do is crucial. And we also know that the difference in just doing the work and the work being impactful is actually you. When it comes right down to it, you are the intervention. You help to infuse tools and skills that you then convey, but you make the difference. But here's the thing. We know resilient providers help to foster resilience in others. But if you're not resilient right now, how is it that you're showing up for those you have the privilege of serving? So let's start to change the dialogue and narrative right here, right now. And let's start to focus on self-care. Now, I want to provide a little bit of a different definition for self-care than you might be used to. And my definition of self-care is just those intentional, purposeful acts designed to recharge me. So with that focus of it has to be done intentionally and purposely, and the focus is on me. So that means not my scholars, means not my family, not my children, not my partner, on me. We have to start to think different about our self-care. Now, what I find is that there are so many different myths that we tell ourselves that really impede us engaging in that self-care. What do you think is the number one myth people feed me all the time about why they don't engage in their self-care? I don't have the time. Sean, I'm already lesson planning for next week. Sean, I'm thinking about what I have to do when I get home. Sean, my emails are stacking up as I'm here listening to you speak. I don't have the time. What we have to recognize is a couple of things. Is that every single time you put your to-do list together, how many times have you ever reached a point where there was nothing left on your to-do list? Ever? Ever? Because if you're that person, we need to talk. I want to learn from you. The reality is that there's always going to be more to do. And if I don't take the time for myself, the time will never be there. But the other thing we have to recognize as we think about time is that meaningful self-care can be done in small bits of time, even 2 minutes, 5 minutes, 10 minutes, 30 minutes. That self-care doesn't require large amounts of time for that purposeful, intentional activity to recharge me. Now, the second most common myth I hear is that self-care is expensive. People want to tell me, Sean, you know, I hear you talking, and if I got that massage 3 to 4 times a week, I mean, do you know my salary? I'd be broke. But what we also have to recognize are what are those myths we're telling ourselves to keep us from engaging in our own self-care? And how is it we're putting up our own roadblocks? Now, the third most common myth, and one of the myths I find is really the hardest to combat, especially for all of us who are nurturers by nature, is that self-care is selfish. Now, In addition to that myth, we know that there are also a lot of gendered and cultural messages that really help to instill that deep within us. And so this becomes the hardest one to combat. But what we have to recognize is that self-care is crucial. You are the intervention. Now, many of you, like me, probably hopped on a flight yesterday to get here. And if you didn't crash from exhaustion in that seat before the flight attendant came on and announced, those safety protocols, you may have heard something like, in the event of emergency, should cabin pressure change, oxygen mask will fall. And what are you supposed to do with that mask? Put it on yourself first. Why? So you don't die. Now, right now in this moment, we're not on an airplane. We remember, though, how crucial oxygen is for survival. But when it comes to the rest of life, we don't seem to remember that message. That if you are the intervention, you can't pour from an empty cup. That if you have nothing to give, how is it that you're showing up? Now, the final myth I hear from professionals is that I signed up for this work. I signed up to do this work, and I've got to do it till it gets done because no one else will do it. But we have to recognize, what is that cost of caring if we keep feeding into these myths? Now, we've all heard about compassion fatigue and burnout. We all can recite those very clinical, sterile definitions. But what we have to recognize is that for us in our profession, we are more vulnerable to experiencing compassion fatigue and burnout. Namely, because of the vicarious trauma we encounter day in and day out. And that vicarious trauma, or the lingering impacts of being surrounded or hearing or knowing about others' trauma, takes a toll and weighs on us. And so puts us at heightened risk of then compassion fatigue and burnout. I was chatting with someone earlier who told me that for any sort of violent act on campus, they read every single one of those reports. Wow. Wow. How often is it that you're experiencing that vicarious trauma? So we have to recognize that there is a very real cost of caring, and rather than hiding behind sterile definitions, we have to take a few minutes to talk about what does compassion fatigue and burnout look like practically. So, compassion fatigue looks something like this. I did some meal planning, I went grocery shopping, I've got all this healthy, nutritious, good stuff in the fridge, and the only thing I had the energy to do is order delivery. For the third time this week, and it's only Wednesday. I get to work, I've got this beautiful schedule lined out, I'm gonna be super productive today, and at 8:35, my whole schedule is derailed. Because all day I'm moving from crisis to crisis to crisis. I'm moving from I need a sense of urgency. And I know the second I walk in the door at home, the only thing I'm gonna hear is I need, I want, can you? So it seems like I'm working 24/7. So in order to get that brief break, that brief moment of solitude, I take the long way home. Or as soon as I get in the house, I make a beeline for my own room where I shut the door and I say, just give me 15 minutes. It looks like I see a phone call from a friend or a family member, and you know what? I can't deal with any more complaining. I let it go to voicemail. This starts to grow and build, and when I'm not fighting it, it only seems to spiral. That I've taken care of everything around the house, and the only thing I've asked my partner to do is just take out the trash. And now, you won't believe it, but do you know what's still sitting in that kitchen when I walk in the door? The trash. And you know what happens? I lose it over trash. Now the question is this, is it really about the trash? Okay, maybe a little bit, but is it really about the trash? Recognizing that I start to unleash on those closest to me, on my loved ones. My relationships start to become impacted. It even impacts how I rear my children. You know what? I've seen the very best in this world, and I've seen the worst in this world. And my child wants to have a sleepover at their friend's house, and I don't know those parents quite so well. So the only sleepover my child is having is in their own room by themselves. I'm starting to have these dreams that are so incredibly vivid. I'm waking up and wondering, wait a minute, did that actually happen or was that a dream? I'm taking work home with me. Not physically and not literally, but work is coming home with me. And you know what? The whole night I'm consumed with that. I'm wondering, is this learner okay? I'm wondering if that event will be all right on campus. I'm wondering about the well-being of my community. And then the next morning when I go to work, it's dawned on me, you know what? I wasn't even present for my friends, my family, my loved ones. I start to wonder, am I fully functioning or engaging or successful in any part of my life? Or would a monkey do my job better? You know what? Sure, that cold's going around campus, but I've been sick not just for a week or 2 weeks. It seems like this cold is carrying on for 3, 4, 5 weeks. But you know what? I'm just going to chalk it up as a bad cold. I'm getting sick. I'm not sleeping well. I never feel well rested. And these are the things that compassion, fatigue, and burnout really look like. Now, I know some of those things sounded humorous, and some of you might even be thinking, hey, Sean, are you following me around? And if you're thinking that, the answer is no. Let me just be very clear about that. But recognizing that you're not alone. We hear this all the time. And that these are the very real realities about our profession if we're not engaging in our self-care. But for too long, we've chalked compassion, fatigue, and burnout up into something as simple as, well, if I'm good enough at my job, or if I care enough, it just won't happen to me. Or if I'm strong enough as a person, it won't happen to me. Here's the thing. If you care enough and you're good enough, it means you're probably even more vulnerable to experiencing those. So what are you doing to fight that compassion, fatigue, and burnout? How is it that you're engaging in your self-care, knocking down those hurdles of the myths we've built up that keep us from engaging in it? Now, we know as we build trauma-informed environments and we take into consideration the cost of caring, we know that self-care is only the first tier for any organization to go through, because that puts an additional onus on you, because we know the cost of not engaging in my self-care, well, it starts at work, spans into every single aspect of my life. But we also have to recognize the need for building cultures of caring within our organizations, and ultimately understanding how is it we change just not practices, but policies and procedures in our organizations to actually support the well-being of those who do the service. And we have to work to transform those cultures. Now, 2 final points I want to make. Point number 1 is, in my career, I've been very fortunate to have a great number of mentors. But not a single one of my many mentors was very good at their own self-care. That too often we don't even know what taking excellent care of ourselves looks like, because it's never been modeled for us. So here's the thing, I was going to be different. I was going to talk about self-care all the time. And then, you know what my supervisor said to me? I hear you saying the words, but I also see those bags under your eyes, Sean. We have to stop talking, we have to stop knowing, and we have to start doing. That if we want to build cultures of caring, it has to start with me engaging in my self-care to model it for others. And remembering that at the end of the day, you are the intervention. You are the difference. But if you're burnt out, you can't make that difference. Give yourself the opportunity and share just an ounce of that compassion that you show everyone else in your life, and share it with yourself. And recognize that when you start to invest in you, we can show up differently. And you owe it not just to those you serve, but first and foremost, you owe it to yourself, because we know in this work we do, there's a very real cost of caring. So my challenge to you, how are you going to engage in your self-care? Not starting this weekend, but starting tonight. Thank you so much.
Sean, thank you for carrying such a compelling and important message out to us. I would be remiss if I did not take a minute to think about, we plan these sessions out about a year in advance. So, we've been talking about this for quite some time. But certainly this has more meaning as we reflect on our good friend and a mental health champion that recently took his own life. And so, thank you very much.